it needs different stakeholders within the health fraternity to do this. They say, but it's just to go and see what people are doing. I say, no. I did research, I did different trainings when it comes to research, and I can't do it alone. I have to involve the hospital. I have to involve the hospital to also inform the health workers who are there. So I asked them, did you inform the hospital? They said, no. I asked them, how do you intend to do this research? Because these are two big institutions in Banjul that there must be an MOU, a memorandum of understanding, and also a partnership. Between BCC and EFSTH. So they started, I told them to write a letter to inform the CMD. And the CMD by then, it was Professor Nyan. So they said, no, Phabian, since we are giving you the health company, I think you have to do that. I said, no, I'm not working for you people. I'm not working with BCC. And I can't write a letter to them. I believe that you have an admin and you have a project administration. You have to do that. So it was the responsibility of Mamlai to do that. But Mamlai always asks people to write letters and then forward to him to incorporate the letterhead. So when I just say, okay, write this, send your coordinator to go to the hospital. They say, no, they cannot go to the hospital because they are prone to, they don't want to deal with blood.
They don't want to deal with blood?
Yes, because they are always like, personally, they don't like going to the hospital. But I asked them, anyway, how can you do a research at the hospital without going, being the coordinator and also being the manager? They said, now you are the health expert, you can do it. So I went to the hospital. Since I have passion in what I do, I used to work at the hospital, at the EFSTH, that was in 2009. So I went initially, I communicated with the CMD, then that was Professor Nyan, and then he directed me to communicate with the chief nursing officer, that is Madam Sister Haraja, and I explained to her about the intent, that the things that BCC want to do. And she told me, anyway, they came here, but I didn't understand what they want to do. Since now they have you, I believe you can explain to us what they want to do. So that's how I explained to her. She said that, anyway, Phabian, you're used to this system. You're used to doing researches. You've been working here as well. Just do the normal procedures, write a letter, and then we can then identify our health workers. Because it was for pediatrics, and pediatric is children. So at the pediatrics, you have different nurses that works at the both surgical and also at the medical department. So when I informed Sister Haraja, she then called the matron of the pediatric surgical unit. So the pediatric surgical unit, the matron will also call. So we had a meeting, I and the hospital team, including Professor Nyan, and also the University of the Gambia, for the researchers. Because we need research, we need also paramedicals, both laboratories and nurses, to start this work. So since the 23rd of February 2021, I've been dragging with them and informed them that I cannot start this work without having this team. I cannot start this work without having the relevant materials. I cannot start this work without having the adequate facility to conduct this research. Because since it's a bond research unit, we need a building, a structure, wherein patients can be transferred there to do the dressing. So that's how I dragged with them for 1 year, going back and forth, back and forth.
For 1 year?
For 1 year.
Without any contract or engagement?
There was a letter that was given to me, and it indicated that I have to be the head of the health component, especially—
Do you have that letter?
Yes, 1 minute. Especially the research aspect. So when they wrote that letter, it was Mamlai who wrote the letter. I read the letter, and I then told him back that I cannot accept this letter. It has to be amended. There must be a letterhead. There must be a signature from Aston, and there must be a signature from the CEO. So he took back the letter. You understand? But so my communication with them was mostly with the people from Aston, because they really needed this research aspect to be conducted. So then Jonas wrote to me and said, okay, Phabian, can you just please start? They will write the letter. And I replied to them with the letter. I told them that I will not It was offered on the 20th of February 2021. And the letter that I gave them, they didn't give it back to me. So I wrote a letter, offer as a consultant with the City Link Austin Banjul EU project, quoting the reference number of that letter. So when I replied to them, which is specifically here, because what they intend to give me, I told them, no, I cannot do this. What was mentioned is just to do the research aspect, and not to do other aspect, other subcomponents, because the research, the health component have different subcomponents, which wasn't mentioned to me at the initial stage. So I wrote to them. Since then, they didn't give me a letter. But since, like, Mr. Jones was telling me, Phabian, just help us to do this, because we really want to do this, because they've been dragging with BCC based on the five component of the project that they want to do. So the health did not go anywhere, and they needed this. I told them, anyway, based on the passion and my reputation as a health worker and also a researcher, I will just try and do it. So that's how I started working with them.
May I please see the letter? We apply to tender a letter addressed to the CEO, Banjul City Council, on the 20th of February 2021, from Phabian in a Grante, the witness, to be admitted to evidence and marked as an exhibit.
Shall I proceed?
Just wait a minute. We have applied to have the document admitted into evidence.
A letter dated the 20th of February 2021. The letter is addressed to the Chief Executive Officer of Banjul City Council, and it has the caption of offer as consultant with the City Link Austin Banjul EU project, and it is signed by Phabian in Grante Sanyang, and it is copied to the project coordinator, Banjul Austin City Link, BCC. The letter is admitted, and it is marked as LGC/BCC/PIG/002.
As the commission places. Now, what was sent to you was for the health component.
Yes.
And you realized there were 5 subcomponents.
There were other 3 subcomponents.
Other 3?
Yes. Because the project has 5 components.
5 components.
And one of the components was health.
Yes.
And under the health component, it has also 3 subcomponents.
3 subcomponents.
Yes.
And this was not disclosed to you earlier?
No.
And was it sent to you at the first, in an email that was sent to you to tell you about the component, the health component?
It was about on a meeting, or during our Zoom meeting, yes.
And so the letter that you wrote to them was to accept just one of the 3 components.
Yes.
Correct?
Yes.
Okay, let me read it, please. It says, offer as consultant with the City Link Austin Banjul EU project, reference 68 slash Austin slash EU slash BCC slash 73 bracket 1. I am writing to confirm my acceptance of your offer of the 19th of February 2021 and honored to join the Banjul City Council project. I did thoroughly review the details of the position in the letter of offer I received. The monthly remuneration captured in the letter is $25,000 for one task, which is a research component to be conducted at the AFSTH on the health component Austin Banjul EU project. A detail of the health component wasn't specified at the inception. Having started, I realized that the health component has 5 subcomponents. So it's not 3, it's 5.
Okay.
Correct?
Yeah. Let me just confirm here something.
Can you hear me?
Yes, I can hear you.
So it should be 5
Five
subcomponents.
component. Okay.
No, I stand to be corrected.
Yeah. Actually, let me just confirm it is key. No, it's supposed to be 3.
Please speak into the microphone.
Yes.
5
Yeah,
subcomponents.
5 subcomponents. 5 subcomponents.
And one was
research.
only highlighted to me to work on. Which one was this?
Come again?
Which one was highlighted to you to work on? Which
Research.
Research.
Yes.
Now, I would like you to increase another $10,000 in addition to what has been offered due to the multiple tasks I'm doing for the health component. I have started all the subcomponents and will await a further correspondence from your office and a new contract offer letter. I look forward to working with you and your team. Now, to start with, what are these 5 subcomponents?
The 5 subcomponents, if I may read here, one of them is
You have a document you're reading from,
yes.
and what document is that?
This was the letter document I requested at the beginning before I start. That was about the project, that is the Future Proof Banjul City Austin project, regarding the different components. And also they sent me just the highlighted health component, including the 5 key cooperative actions. So they sent me this document wherein the health aspect was captured only. The health, yes.
May I please see that document so that we can have it admitted as well?
Okay.
Then you can elaborate on it. We apply to tender a document produced by the witness from the Austin project. Who sent you this? The coordinator?
Jonas.
Jonas sent you this.
Yes.
Right. To be admitted to evidence and marked as an exhibit. It has the 5 key cooperative actions for the project and the health component as well.
Madam Phabian in a grant, Sanyang,
Yes, please.
is this the project document that you presented to the Banjul Ostend project?
No, no, no. This was given to me by Jonas. I requested for the different subcomponents, the health aspect.
Okay.
Yes.
So what is this? What is this document?
It's about the subcomponent of the health project.
Okay.
Yes.
Which is addressing the issue of business, social inclusion, innovation, health, and environment.
No, the last ones, the down. You know, they have their key 5 components for the project. So one of the key 5 components was, one of them was health.
Yes, yes, yes.
Yes, so that health now, the breakdown of the health component.
Okay.
So that's number 5, making healthcare and hygiene practices more accessible and exploiting the potential of medical plans.
Yes, my challenge is that it doesn't have a caption to classify the document,
No,
you know.
because the full document is with them.
Okay.
So you're not
So
just
this was an
captured
extraction
from the full document,
So
which
this
I've
is
never
the
seen the full
document that is
document.
showing the 5 key cooperative actions
For-
that,
yeah.
for that you were supposed to deal with.
Yes.
Thank you. The 5 key cooperative actions presented to the witness for execution is hereby admitted in evidence as an exhibit, and it is marked as LGC/BCC/PIG/003.
Ask the commission, please. Now we'll give you back the document. You can guide us through the 5 sub-components under the main health component.
Thank you.
Yeah, I've asked the witness to guide us through the 5 sub-components under the main health component.
Okay, should I state them?
Yes.
Okay. So I'll start with the one I was informed to do, which was the Bond Treatment and Recycle Center.
Where can we find that? Which page of
This document at 5.3.
5.3? Okay, please guide us through 5.3.
5.3 was dealing with bond treatment. So
treatment.
yes, bond treatment to test the effectiveness of aloe vera fresh leaf compared with 1% SSD, that's a silver sulfidized cream, in the healing of first and second degree burns, which was a comparative study.
That is the main
Yes.
health component itself.
Yes, yes.
Okay.
So the main health component, that is the research aspect. So since I mentioned at the beginning that I cannot do it alone because it's a team, it should comprise a team. And when they mention the fresh aloe vera leaves also, this is an other outsider who should provide the aloe vera leaves. And also, there must be also a treatment center
Fresh
for,
aloe vera makes it one sub-component.
no,
Is
no,
that
no,
what
it's
you're saying?
incorporated. It's all.
Okay, please proceed.
Yes. So now also, when dealing with burns, because at the hospital, after having several meetings with the hospital team, normally their burns patients are being treated on top of their beds. That's where they do the dressing all. I told them, since it's a project, and the project, because I requested for the budget initially, but they didn't send it to me. I have to go back and forth to know what it entails. Because dealing with an other institution, they will need to know the budget to involve their staffs.
You asked them to provide you a budget,
The health budget,
the health component budget,
yes.
which they never provided.
No, until I asked for it, then Peter sent it to me.
And you have that?
I have the budget.
Can we please see it?
Okay.
So we apply to tender the health budget component as produced by the witness for the BCC Austin project into evidence and to be marked as an exhibit.
The budget health component of the Banjul Austin City project is hereby admitted in evidence as an exhibit, and it is marked as LGC/BCC/PIG/004.
As the commission places. Now we'll come back to the budget, but please proceed with the components.
Yes, so when it comes to the health, after providing the budgets, I told them, okay, since the research, I'm tasked to spearhead the research aspect, I have to at least recruit some staffs from the hospital. So that's when I went to the CMD and informed him. So the CMD identified the deputy CMD to work with me and also with other staff. So the deputy CMD was recruited and they informed the doctors about the project.
Who is the deputy CMD?
The former deputy CMD was Charles Robert.
Charles?
Dr. Charles Robert.
Charles Roberts,
Yes.
the clinical investigator.
Yes.
Proceed, please.
Yes, Charles Robert. So then after, when Charles Robert informed the chief matron, Sister Horeja, so as I explained, Sister Horeja also called the other staffs and mentioned to them about the study, and the other staff were informed, okay, this is a research that will be conducted here in the hospital, so we need also guidance of researchers. So since the letter mentioned that the bond research mentioned that the possible stakeholder, one of the possible stakeholder is the University of the Gambia. University of the Gambia, there's the nursing and midwifery department. So that's where I went, informed the head of the department that this is the research that we are supposed to do.
Who is the head?
The head, Dr. Gina Bassi.
Doctor?
Gina Bassi. So she was identified as the PI, since it's nursing department, PI, principal investigator.
Please proceed.
And we have also a co-principal investigator.
That's Jennifer Sisao,
yes. And the co-principal investigator, Dr. Thomas Sanger. So we started that team now, and the Sister Horeja, they identify 4 nurses there. And then since it's health, and according to the Austin Bank State Council, Red Cross is also part of it. So they identified 2 Red Cross staffs who were already intern at the hospital.
Their names?
Rabiatu Jalo, I believe, and also Shehu Kamara.
Right. Proceed. And,
Yeah.
And Shehu Kamara?
Shehu Kamara or Sisao? Sisoho, I can't remember his last name.
Shehu Sisoho.
Shehu, yes.
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 Proceed.
So then, since it's also bonds, dealing with some bonds can also come with infection. The team, when we have the meeting with the full team at the hospital, they mentioned that the laboratory must be part of it, the laboratory, and the laboratory head was informed, that is Dr. Hadiba, was informed about it. So she too also identify 2 lab technicians to be part of it. And also we need also a data entry clerk that was also identified. That was Fatou Cisse as the record officer. So that's how the team was set up, yes. Because I did not personally recruited them, but it was through the hospital and the university that recruited staff to work with me. So since BCC, the project wanted me
not
to
through the university. It was done informally, but you consulted them informally.
Yes.
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 So it would not be through the institutions because communications would have to be formal, and we don't have evidence of that yet.
Yes. Yeah. So that's how we composed that team. The nurses were identified by the head nurse. The CMD identified with the CMD, and also the lab heads also identified the staffs, and also the CNO also identified the clerk. So that's how we composed the team, and we had the meeting. So once that meeting was conducted, they asked me, okay, how much is the research? Because at least they have to just support the staffs who are there, who are being part of the project.
Before you proceed, I still want to see the 5 subcomponents of the main component.
Yeah, because I was focusing more on the research.
Yes,
The
but can you name of the 5
themes, yes, okay. That is accessible to healthcare, which I didn't cover. You also have the...
You did not cover?
You also have the proposal, hospital hygiene education, self-sustaining program.
Proposal?
Proposal, hospital hygiene education, self-sustaining program. That is 5.1. Then you have 5.2, proposal, accident and emergency care ward, which wasn't also covered. The burn treatment and research center. Yes, that burn treatment and research center. That was covered, yeah.
That all?
Yes, that's all.
You named 4.
But that's what I have here.
By my count, I have 4.
Yes.
Okay, let's proceed.
Okay. So okay, since it's the burn treatment center, and after that composition, I told them, okay, we need to do a lot of things before we can start this project. Because before we can start this project, one of the things, since they wanted the aloe vera, they need to provide aloe veras. So then Peter told me that they had planted about 500 aloe veras within the hospital. But when they came after a year, all the aloe veras were disappeared. So I wasn't there by the time. I told them, how did you get the aloe veras, the fresh leaves? Because you want an evidence base when it comes to plants to be incorporated at the hospital. So I informed the hospital that, okay, this is what they want to do. For them, they don't want a comparative studies. What they want is a case study. But the hospital told them that they've been treating burns and they have been using other materials, other treatments to treat burns. So why not do at least a comparative studies? That is to compare what they have been doing and also the new innovation. So it was a back and forth thing until at the end they agreed.
But if you don't have a study for the new discovery, you would not be able to do a comparative analysis.
Yes. So what they did was, they had a meeting. We had a meeting, and I told them, anyway, the meeting is not enough because it's a research, and we will need an ethical approval from the hospital research committee. So that's how I told them, and also with the research, we must provide a concept. And the concept will be developed to become a proposal. And the proposal, another methodology, there will be a methodology which will indicate what are we going to do, and how are we going to do things as well. And also the sample size of what we want to do, because we cannot do the whole hospital.
Was it done?
Yes. Let me just proceed before I show you the document. So I told them, since investigators were identified, so we will write a proposal. They will facilitate the proposal, write everything, then we submit it to the BCC and the Austin as well as the hospital. So that proposal was done to talk about how we intend to do it, how aloe vera has been an evidence in other countries, how plants have been used to treat burns, especially aloe vera. So other countries were using the modified one, but Gambia, they want to use the real plant to treat the burns. So that's how we got, the principal investigator and the co-principal investigator, including my support, as also as part of the team, developed a proposal, and the proposal was submitted. So this is the research proposal that was submitted to the hospital and to the research team.
May I please say it? What was this done by any member of the team before, prior to?
They didn't do anything. Nothing absolutely was done within the level, at the level of the BCC. They just wanted a research. But I told them that research, it comprises of a lot of things before we can effectively start the work.
Now, did the team that you, let's pass, did the team that you set up, including yourself, of course, have any experience in this kind of research, this specific research, not kind of research, specific research in relation to aloe vera?
No.
Before?
No, we were doing, we normally do public health researches.
You?
We normally do public health researches.
Yes.
So this.
Go ahead, go ahead.
So this is also a public health research. So this was a new thing. So we did, that's why I told them that we have to write a proposal. We have to find literatures regarding this aspect.
Okay.
Yes. And I asked them, so they told me that no, normally they will not do it because there is an organization called Care for Natural, and they have been using aloe vera to treat burns. I asked them, where is that? Is it an institution, identified institution, certified institution? They said, no, it's just a community, local people that does use the aloe vera to treat the burns.
We apply to tender the research proposal with the title, Effectiveness of Aloe Vera Fresh Leaf Compared with 1% Silver Sulfadazine. Did I say it right?
Sulfadazine, yeah.
Sulfadazine cream in the healing of first and second degree burns at Edward Francis Small Teaching Hospital, a comparative study. There's the Banjul City link, Ostend, and at the University of Applied Science at Ghent University. So to be admitted to evidence and marked as an exhibit.
The research proposal titled Effectiveness of Aloe Vera Fresh Leaf Compared with 1% Silver Sulfadazine Cream in the Healing of First and Second Degree Burns at Edward Francis Small Teaching Hospital, a comparative study for Banjul City, Ostend, and Atfield University of Applied Sciences, GENT. This research proposal is admitted in evidence as an exhibit, and it is marked as LGC/BCC/PIG/005.
As the commission places. Now, these individuals were appointed or employed.
No.
The ones that you identify, is it about 17 of them? How many of them?
Yes, about 17, I think, 16.
17. Now, were they appointed as employees or contractors for the project?
No, they weren't appointed. They were identified.
Yes.
They were identified to support the research.
How were they remunerated? How were they paid?
They were paid initially. Let me go back to the budget. When they showed me that budget, that's about 2.1.
Do you want to see the budget?
No, it's 2.1. For the research aspect, it's 2.1. 2,100,000.
Okay.
Yes. So when I told them, okay, this is the budget, and you know that I told them this budget is not enough for research. It's too small because we are going to recruit people, and also the same budget, that's where they were going to purchase the aloe veras.
How do you know it is too small?
Yes, because we did a breakdown, I and Jonas.
Do you have the breakdown here?
Breakdown is here. Breakdown is here. And also, they were supposed to build a structure, and the structure must be equipped. The same budget we have to buy also consumables for the patients.
Let's see the breakdown. You prepared the breakdown.
Jonas and I, and the former accountant, that was Ndei sister, something like that.
But it has come from you. You were the expert.
Huh?
So it has to come from you. You were the expert to show that it is not sufficient to cover that component. That would come from you. Am I correct?
Right?
We apply to tender the proposed budget aloe vera bonds and research into evidence as an exhibit. Did they increase
Yes.
the budget?
Yes.
Two?
Here. Yes, it was increased. No, they didn't increase that budget, but the personnel, it was increased.
What was increased?
For the personnel,
For the personnel?
yes.
What do you mean the personnel was increased?
The support staffs.
The number was increased
No, the amount
to be paid.
to be paid.
Yeah, that will comprise of the budget, would that not?
Yes, but I will later explain.
Okay. You go ahead and explain. I want to see whether we tendered it to.
Yes, so when they,
same.
yes, for that budget, so the same budget, that's where they're supposed to get the plants, that's where they're supposed to also construct a center, that's the bond center, at the same time also buy consumables, and also for nutritional support for the patients, the identified patients, because we were supposed to, the sample size about 52 patients, but since it's bond, we didn't, there was a limitation to get all the 55 candidates that we wanted to do the intervention of the research. And also, like, regarding the project, the construction of the place was not under my side anyway, because I told them that it doesn't concern me. Let them go with procurement, and the procurement officers will communicate with the hospital, with the technical staff, with the support staff, to give you a budget of how much will it entails for the center.
The bond center.
The bond center.
Was that done?
It was done. It was done.
It was constructed.
It was constructed at the hospital, attached to the bond unit. That's where we normally do the treatment. It was constructed, and also the consumables, the things that were needed for the center.
Yes.
Some of them were provided
By
by the project. Yes. So because they deal with one of the constructors at the hospital, and they were doing it with.
They were doing their own procurement for that. For
Yes, they do
those
their own procurement with the former procurement officer, that is Keta.
Would you have the list of the consumables that were procured by Mr. Keta and team?
No, since I told them that it's not part of my mandate, I cannot.
Yes, but what was procured?
It was what was they had their own thing. They did.
But you are overseeing
I'm
the.
overseeing it, but it was not under my side. It was
Well,
construction.
you would need to know what is procured
Yes.
for you to have results in the research.
That was submitted to them to communicate with Keta, and Keta prepared at least, I think, a BQ something,
Yes,
BQA. Yes.
I don't know.
So it's about building. So I didn't really focus. What I just wanted is let it be done.
Okay, it's about construction.
It's about
It has
construction.
nothing to do with the actual health consumables and all that.
Yes. So so they did it, and they recruited their own person in partnership with EFSTH technical team. So that's how, after constructing, because we couldn't start the work without that building. So at the end of the building, now I thought, okay, now we need the aloe vera. Where are we going to get it? They told me that, okay, they got it from Care for Natural, that is in Maria Makunda. I asked them, how do they know that person? They said, oh no, she's a Dutch lady. She normally does that. She had like 100 hectares planted with aloe veras. So that's how they connected me to her. Yes. And I told them, okay, since they said that like they can get it from her, and she has been doing some bone treatment with aloe veras, can we also organize our team, to go and visit that place? So they organized it. That's how we all went to the center and met the lady who does it at Maria Makunda. She has, yes, the hectare of aloe veras. And we also met some children there, line up for the aloe vera treatment.
Now, let me assist you.
Yeah.
For the part, especially the financial part concerning you. How were these 17 people?
Sorry, Council, can I admit this
Yes,
document?
yes. She has a document that said that
No, you
perhaps
have,
it's an addition.
you have already given me.
Yes, I want to
the
see whether we can.
proposed budget.
Yes, I want to see whether the two documents are, to apply to have it as an additional document, because it appears as if that document gives meaning or completes the document you have. Let me see the document you have. This is the additional names of the people.
So these are the names
Of
the support staffs.
10 of them. Is that different from the previous one?
There's a 10 listed, but you have breakdowns of the nurses.
You have what?
The breakdown of the nurses.
Yes.
Yeah.
Okay, we applied to the Bond Research Clinical and Support Team together, Honorable Chairperson, with the document you have. There's the this is the budget. Surprise.
Proposed budget, which is the aloe vera bonds research, and the bonds research clinical and support team. These two documents are admitted together as exhibit in evidence, and they are marked as LGC/BCC/PIG/006. Council, before you proceed, can I have the stapling machine? Let me staple this. Madam, can you please the stapling machine? Confirm for me whether this, look at the budget which we have just admitted, that is LGC/BCC/PIG/006. Is this the budget, and is this the correct budget? Look, yes. Please take a look at it and tell us.
Come again?
Yes, I said, please take a look at the budget.
Yes.
Is it correct?
This one was given to me by Jonas that was extracted after
Or
developing.
can you look at it again to see whether it is correctly presented? Madam Sanyang,
Yes, this was the budget for the
no, what I mean
bonds.
is, was it correctly presented?
This one?
Yes,
What do you mean by was it correctly presented?
because when you presented the document, it was not in the proper order.
Yes.
Yes. And after looking at it and going through it, is it now in the proper order?
Now,
Yes.
after being arranged, yes, it's in the proper order. But what is here and the previous one that is highlighting the research aspect, which is 2.1, and what is here is not the same. Reason being, I asked them when I started, you told them that like 2.1 was highlighted for the bond research, but why do we have 1.7? And what was informed to me verbally is they took some of the health money to buy consumables during the COVID-19. COVID-19, they bought some masks, hand sanitizers, and others to supply to the communities in Banjul. So you can see the 2.1 doesn't reflect here. You understand? Because they started things before I even started with them.
Yes. Now, my second follow-up question is there any communication attaching this, when you were being sent this part of the budget, because you said it's lifted from another document? Because my problem is there is no signing off on that document to show where it is coming from and who gave it to you. And there is nobody signing off on that document. Right?
Yes, no, there was.
Was there any email attaching this document
No.
when it was sent to you?
No, well, Peter, by the time Peter was in the Gambia here, so they just extracted it and printed it out for me to take a look. So when I took a look at this, some of these items were not in line, but there was nothing that was signed. Because what they wanted is they just wanted this to be done.
How did you reconcile what is in this? Because if I am correct, what is on this exhibit is proposed budget.
It was a proposed budget,
Yes. What is in the other document? What is it? What is in the other document? Is it the actual?
The proposal. Which one? The first one I
The one
sent
that
that?
has the 1.1.
2.1.
Is it 2.1 or 1.1?
2.1.
Yes. So that 2.1, is it the actual or also a proposal?
That was the actual budget from the project that was extracted and printed out for me to take a look.
So it is different from this one?
Yes.
As you have just said?
Yes.
Okay. The council will further ask a question.
Okay.
Please let me have it back. And let me just give you this research proposal. Please take a look at this document. It's Exhibit 005. Now, this document, give her this document. Please take a look at the document.
Okay.
This one.
Yes.
Please go through the document. Yes, please go through the document and see
Okay.
what you can tell us. Is it just one set or two sets?
Yes, it's two sets. It was
And do you
printed out
agree that
and
it is also not properly
yeah.
put together?
Yes, because I
And
just
who is
printed
the
it
author
down.
or who is the author of this proposal?
The research team,
And who is the head of the research team?
Dr. Gina Basi and
Who?
Dr. Thomas Senghor. Dr. Gina Basi, Sisao,
Yes.
and Dr. Thomas Senghor. Can you just look at this?
Is there anything to show on this document that
Yes.
they are the ones that authored this document?
No, there is none.
And why is that the case?
It's here. It's here. No, it's here.
Please put it all together again because it has already been admitted in evidence. I just wanted you to confirm that it is two sets, one of the same,
Yes.
and that it is not properly arranged.
Yes.
Thank you. And that it doesn't have any authentication of who must have prepared this document.
Right.
And you were using this document as your basis for doing your work.
Yeah.
Can you please
Yes, because
respond on the
yes,
mic?
because normally when we say research, we cannot just go and start the research like that without having a proposal. That the proposal is the guide for the research.
Thank you. You can give her back the documents.
You can give them
Please
one.
put it all together again
You
and
can give them
staple it.
one. Yeah.
It's already admitted in evidence.
Okay. It's not complete. This one.
Counsel, you may proceed.
It's not complete.
How were they paid or remunerated?
Yes. Initially, when we started, the team was identified. I asked them how are they going to pay it because they said that like since they thought that it was only one man show, not knowing that other medicals or professionals must be involved. So they didn't have the details of those persons. So what they did initially, they said, okay, why not we give you the funds, the initial stage, to pay them, excluding the researchers. It's just the support staffs. So I told them anyway, from the research, from the project, it said good governance. I don't think that they have to give me the money.
You don't think?
They have to give me the money to go and pay them. But since the people, they've started the work and they have not been paid, so they asked me for their money. I told them anyway, BCC must come and pay you. So I've been going back and forth with them until finally they gave me some of the staffs, their funds, to go and pay them, and they also signed a voucher.
When
So-
was this?
When we started the kickstart of this project,
When did you start the project?
yes, so what I want to confirm here. Actually, I didn't print out that. I can't remember the actual date that we started.
Did you start in 2021?
2022.
2022?
Yes.
For the support staff?
Yes, 2022.
Because your acceptance letter is 2021 February.
Yes. 2022. We started 2022.
But when did you start?
When did I start?
Yes.
When did I start the working with them?
Yes.
I started working with them in 2021,
2021
February.
February.
I think February, yeah.
How many of you started in February 2021?
It was only me.
And when did you start having additional team members?
Before we start the project. After they have been identified.
Okay, if you don't have it on top of your head,
Yeah.
we can give you time. We will be going for a tea break shortly, and you can arrange that piece of evidence and then provide us.
Okay.
Now, how was it decided as to how much they are going to be paid? The 17.
The 17, 3,000 was decided to pay them, I believed,
Monthly.
per month. Just
For
it
how long?
wasn't actually a payment. It was just also as an allowance to support them because they were already part of the hospital.
Yeah, for how long?
It was meant for 1 year. Then after the 1 year, because the project it has a timeline, but we couldn't reach the timeline.
What's the timeline?
The timeline was for 1 year.
1 year.
Yes.
And you could not be
Yes.
ready within a year.
Yes.
Why
So-
was that?
Because there were a lot of delays. And also the second aspect was like, we're talking about bonds. And normally in the Gambia, the time we mostly receive bond cases is during the Hamatan and the Ramadan. Hamatan and the Ramadan. So you can see that but in between, you can have sometime 1 or 2 accidents that can happen. And also parents can bring their kids for the treatment. So since it was an agreement was a 1 year, even with cases or without cases, they still have to support the staffs who are there in case. They can receive patients.
Why was it supposed to last 1 year?
That was the agreement.
No, but why? What is the relevance
That was
towards the research?
that was the 1 year was given to us by Austin people.
No, but you as an expert, why do you need 1 year?
No, 1 year I told them that it's not enough because it's a research.
No.
Because normally I told them it's a research. We cannot identify the period that we have to start and also end. Because when it comes to research, at least we need a baseline. You understand? At the beginning of as a baseline, then we need also a midline and also the end line. So
What is the
evaluate the
baseline?
progress, the starting of it, because it's a new thing. We need to know what's happening. So once we do the baseline, we need to also go to the patient, explain to them about what we are supposed to do, or the hospital also what we are supposed to do. But for them, they didn't look into that. They have their own agenda. Okay, let's do this just for 1 year, and we are done with it. That's why I dragged with them at least for 1 year before we can start this project, what we need to do, what we're supposed to do. Because research, we cannot just rush research.
So within the
because
1 year
I was already working for 5-year research.
Within the 1 year before the project started, what was you were still being paid?
I was paid because I was to oversee the health component, and the researchers also were paid as well because of the documents that they were writing, because they have to prepare a proposal. They have to also seek for consenting to start this work. They have to prepare also the questionnaire.
And they were paid for 1 year?
They have
Before
been
they
paid.
start?
Yes, no, Yes, they were paid for 1 year. No, not up to 1 year, but between some months
Before they
we can
started.
start. Yes.
But my point is, you said they had to do what? They had to write a proposal,
They have to develop a concept.
concept note,
Then from a concept note
to
to
get a consent from the
Concept.
Secretary General's office.
no. A concept, a recite concept.
No, I had the concept note
Yes.
part.
Yes.
And you said consent. Did you say consent?
No, concept. And then also they have to prepare also a consent document for the patients.
Okay, concept document for patient.
Consent.
Okay.
They also have to prepare study questionnaire, the study tools.
And that will take 1 year.
Huh?
Or
No. It's a procedure because it's not part of their work. They also already have their own work they are doing. But they have been identified as researchers, so they have to prepare all this document before the project can, before the
Whose work
actual
was supposed
research
to
can
be that?
start. Come again?
Whose work?
The PI and the co-PI.
They're the ones to do this.
Yes.
Why did they not do it?
They were doing it,
How many of them?
2.
So only 2 were paid for a year.
For the period they started, when they started the work.
Okay.
Yeah. So also, along the line, after writing all those documents, they have to also seek for ethical clearance, because dealing with human subjects, they cannot just go and start the research
Where
without
are they going to
getting.
seek that from?
Come again?
Where?
Ethical from the hospital.
But the hospital was already given the green light for this.
Yes, they were already given the green light.
So there shouldn't be
To
any
do-
technicality in that.
Of course, there must be, because it's research. They need ethical approval before they can reach the patients.
How does it work, the ethical approval? What is the procedure involved?
It will send to the scientific committee of the hospital. So the scientific committee, you have also, this document was submitted, and it also have to be presented,
How long does it take?
presented panels.
How long will this take?
That was just, it's a procedure. We cannot tell you how long, because
long did
there's
it-
going to
did
be
it- did
back
it
and
take?
forth. Back and forth. I can't tell you actually how long it takes, but at the end of the
No, from the point
document,
it was sent and received, how long?
this was sent April 6th
Yes.
to the ethics committee. So because
2021?
2022,
22, okay.
yes, ethics
And-
committee, and it was then sent to them, and it needs to be reviewed. So it's not only this document that they have to review.
When was the clearance received?
The clearance was received May 2nd.
So it's a month.
May 2nd, yes.
Let's say a month.
Yes.
Now, for how long did this team get paid monthly, the allowance? How long did it take altogether?
I can't remember how long, because I know that at the end of the research was for 1 year, and at the end there was also an extension
For
to continue with the research.
how long?
For 6 months.
So altogether it's 1 year, 6 months.
Yes.
So they were paid 1 year, 6 months
Yes.
every month.
Every month.
Okay. And you were paid in total how much?
Per month,
Yes,
25.
25.
Yes.
You've asked for an additional $10,000. Was it given?
No.
Why?
They told me that they didn't tell me any response, because I was waiting for the letter.
So you have seen the budget. Did you exhaust the budget? What is budgeted for? And what is paid to you altogether?
I didn't see the budget. That was like the whole budget that was paid to me, because they didn't even pay me all.
I mean the health component.
Yeah.
You saw you requested for the budget. At some point you were given the budget, correct?
Yes, but not actually what I was being paid.
Come again?
Not actually what I was being paid.
Not what you?
Was paid.
I don't understand what you mean.
That budget was to have an overview of how much is the health component,
Yes.
especially the research aspect.
Yes.
Yes.
Now, was this budget exhausted based on the team that you guys formed?
I can't say
The
it was
purchase of
exhausted.
items or goods, the allowance is paid. The $1.2 million is
1.2 million, 2.1 million.
2.1. Sorry.
Yeah, I can't tell. I don't know whether it was exhausted,
You did
because
not-
I wasn't dealing with them directly with that.
Okay.
Yeah.
Now they gave you some money to do some purchasing.
Purchasing, yes.
How much?
I can't remember how much. Normally, I request for certain things. So if I request what they cannot buy, that's what they will give me to buy.
Please proceed with your evidence.
Yes. If I cannot buy, what they cannot buy, that's what they will give me to buy. Like small consumables at the market, like towels and other things that the patients will need.
So you don't know how much altogether you were given?
No, I can't remember.
Were you given a check at any point in time?
According to my statement, it was mentioned that Mamlai mentioned that he gave me 125,000, which
Yes.
I cannot even remember him giving me the money. And he is not here for me to ask him what, because anything that I am taking, I normally write a request. I will write a request to the project manager and then copy the CEO.
Do you have all your requests you've written for this?
I have them soft copy.
All of the requests?
Yes.
Only soft copy?
Yes.
Okay. During the break, we will try to see how we can extract that.
Only one is here, that is the recycling in materials that I have here.
Okay.
Yeah.
Just hold on to that. Just hold on to that. Now, you have the report at the end of the research?
Yes, I have a preliminary findings of the research.
Preliminary findings?
Yes. Because remember, a proposal was written.
Yes.
Yes. So one of the outcomes was like to write at least the preliminary findings of the research. It's here. Then at the end, I have also informed them about the health component report that I have, the report that was also submitted. Which one do you want first?
The two of them.
Both of them?
The two of them.
Yes, because I have one here, which is part of the outcome of it regarding the bond research. 2 patients. So I don't think, unless you request for it, so I will give it to you.
How many patients did you examine during this process?
42.
42.
We have 42.
Just a little bit short of the target.
Yes, because it's a research. We have our limitations.
What would you say is the difference between a preliminary result and a final result?
It's a preliminary. Let them look at it, and then at the end, we'll submit the full report.
Was that done?
That was done. That was done, but they did not reply back.
You submitted they didn't reply to the preliminary result?
Yes, I sent it to, because I was directly communicating with Jonas. So when he looked at it, he mentioned to me that it is approved, it's okay. What you need to know is whether it was done, whether we have reached our sample size. You understand? But the unfortunate thing that what they wanted is for us to complete the 52, which was not possible. The 52 patients. Even with the 42 patients that we have seen, I think 26 or 21 were eligible for this.
So do you take this as a final report, or is it still a preliminary result that is yet to be responded to?
Yes, because we have to also report it.
Yes, to what?
We have to, it's not yet finalized.
Okay.
It's not the complete thing.
It's not complete.
Yes. So I was waiting for them to reply, because we can give them. This is from the researchers themselves.
And when was this? When was the preliminary result prepared? But there's no date on
There's
this.
no date.
No
Unless
date.
I check.
It's not authenticated.
Yes, unless I check the dates online, because it was all my correspondence was online. Unless I check the date that they sent it to me.
Yes, but my point is, you cannot tell from the document because there's no date, no signature.
Yeah, that's why. Yes, that's why I say it's not yet finalized.
This should be in 2022?
2023 or 22?
2023?
Yes.
Ending of 2022 or 2023?
End of 2023.
2025?
Yes.
Why do we not have a report still?
We're waiting for them to review and then give us the go ahead.
I am not saying you are at fault yet.
Right.
I am asking a question as to why we don't have a report. Did you write back to them?
I wrote back to Jonas.
When was this?
The same time when I sent him to this.
We're waiting for their reaction to this.
Yes.
And they still haven't provided any.
Because they were expecting like the team from Austin to come, and we have also like the dissemination of this before they can finally approve it. But unfortunately, there was back and forth. The team couldn't come to complete.
We applied to tender the preliminary results and also a memo addressed to the project coordinator from the health component consultant. The date is 8th of July 2023. The subject health component report January to June 2023 to be admitted into evidence and marked as exhibits. Why do you not sign your documents?
I signed up in the memo where my name is.
Come again?
Where my name is highlighted.
I can't hear
Because
you.
this is the printout.
Yes.
Yes.
Where are the signed copies?
It's with them. I submitted everything. These are printout that I printed to this morning.
Can you provide?
And then also,
can you, Madam Sanyang, can you provide us with the evidence of you writing to them, submitting these documents?
yes,
So
it's
that,
online.
we will correlate that to the report because there are no authentications in all of these reports
Yes.
that you have presented to us.
Okay.
Send us the emails.
The emails.
Yes.
Okay, that's
Please
fine.
note it down so that you will not
Yeah.
forget.
Yeah.
Thank you.
And Council, there was also a letter that was submitted by the CityLink Banjul Austin to inform the hospital that the project is coming to an end. That's the end of the Health EU project. I have a copy here. That was sent to me by Jonas. Then later on, I asked them to print it out, sign it, and send it to the hospital.
Yes. Let's have these documents admitted first.
Okay, let me hold this one.
Council, it's 11:30.
Yes.
We will admit all documents together when we come back.
As the commission.
Thank you. We may rise.
No matter how.
danañ jël kenn ci line bi wax naa ko sànq am na kenn kuñ tudd ci mbir mi Mamadou Tro Dabo ci surtout ci affaire flight si ni ko jëndee moom tudd nañ ko ci su ko defee moom mu ngi ci line bi bugg naa tontu ci mbir mi pour mu indi ci leeral Mr Dabo, good morning, ñu ngi lay nuyu bu baax. Thank you very much for joining us.
Hello, na nga def?
Jaama rek alhamdulillah, naka suba si?
Okay. Alhamdulillah. We are not in Gambia actually.
All right. Yes. Thank you. Understanding yaa ngi follow programme bi and then da nga bëgg a indi leeral wala tontu ci li am ci nuñ la tuddee ci report bi nga xamante ne Gambien si yëpp ñu ngi ciy wax report bi mu ngi feeñal ne ci flights yi nga xamante ne jaay nañ ko aircraft si raada am na loo ci jënda ñett ci flights yi te amount bi ñu bari am na luñ ci wax ñu bàyyi la rek sa réaction Gambien si ñu ngi lay déglu loo ci bëgg a leeral.
Well, xam nga Gambia dafa tuuti, it's a small country, right?
Yes.
Gambia ñëpp a xamante. Ku nekk xam na kan mooy kan. Man ba ma juddoo bente musuma am even contract from the government. So I have nothing to do with government actually.
Okay.
Waaye lii naka la demee boy bi lum binda, I'm very happy because Gambian ku nekk war na kontaan boy bi lum def, right?
Okay.
Waaye man suma concern bi mooy journalist bi mus na ma call ñëw suma office mu laaj ma jox ko all the necessary papers, receipts, transfer, everything. So waaye lu ñu wax air tractor bi actually sax bañ ko advertise man yëguma ko suma benn partner tubaab la moo ñëw suma office mu ne ma ta gaay ma ngi gis ñu ngi advertise ci air tractor. So ma ne ko what is air tractor mu ne benn ma plane bu ndaw la waaye scrap la mu ngi ci airport waaye ñu ne kenn bëggu ko. So ma ne ko okay mu binda mu jox ma lettre bi ma yónni yow ma fa sax man ministre boobu xaw ma saane man xaw ma ko si biir nit yi actually.
Okay.
So to make it short dañ ko lifine ba pare tubaab bi dem gars yi bañ pare ñu call ma call tubaab bi waaye tubaab bi mu ne is far and secondly gis na ne tracteur boobu soxlaatu ko waaye bind nañ ko ba pare. So ma xam ne no way to way because man la use pour binda. Then I decided to pay money. That one is a small money actually. It's about munuma remember. Then bukira am solo moy aircraft. Aircraft then go advertise.
Okay.
Then go advertise to make it short. Guy ñu ne dañ advertise flies. Why only tubab ben yeneen tubab yu jógee South Africa ñoko bit. So man decide pour bit ko waaye bala ma ko bit dama laajte air fly kan moo ko ñu moom ñu ne government moo ko moom soo gisee Minister of Finance di ko jaay because of it belong to the government. I say is it different with Jammeh's property ñu ne ma Jammeh's property Janneh commission mooy i jaay boobu waaye bii government moo ko jaay.
Okay.
Man, are you sure you never yes? For now, like now 2 or 3 people, sir. Then none la binde. Why bemoko binde?
Time you could be now. Mr. Dabo, can nga don wahal? Is it a minister at the time? Wala kan mo don jay flight si wala aircraft si? Kan nga don wahal?
No, man kuma don wahal ko airport la neka.
Okay.
Because our connection in because Mambure mo fane konte. Munala watal sumaya Mambure musuma ko gis ante mom face to face. Since last regime, this regime musuma gis Mambure face to face.
Okay.
So bema xamé lolu non la bindi. Kuko binda ñu ne dafa binda 200,000. Man ma $500,000. So why be offer bi dem information buma am ñu dañ phone man dalasi la wax $500,000 I'm sorry am na ñeneen ñu ne fan la mëna dulé bobu then deadline bi joté am na benn jigéen bu ma call mu ne ma yaay higher bidder we will give you from now up to 2 o'clock if you can pay non la démé bank ma def transaction within 12:30 ma fay xaalis bi transfer bi ma jël suma receipt bi daw ma fa sax dama ko dugg ci envelope ma yónni suma odli bi mu yóbbu ko Minister of Finance.
Okay.
Then bi ba loolu passé in fact fly yu ma la wax nag man am na fa fly yu mag si sax ñu ngi taxaw si airport even today right now. Bu jaar ci airport bi sax soo xoolee da ngaa gis fly yi foofu man sax fàtte naa ne sax dama jënd fly because the point is lu tax man ma def ko because tubaab yi ñoo ñëw bu ko jënd fly te man feel naa ne man Gambian la te mun naa ko waruma allow pour foreigner yi ñëw jël fly yóbbu loolu tax ma jënd fly.
Okay, léegi comme yow yaa ko jënd go ahead.
The big flights are still at the airport. Ku jaar airport rek na la wax ne sooy wàccee rek da ngaa gis fly ñu ngi taxaw fi. So waaye man lan mooy suma problème. Yes man luñ ma wax is not Jammeh's property it's a government property waaye boy bi suy bindee all the time this is 3 times mu ngi binda waaye suma nataali headline moom la dee def si newspaper am loolu dafa jaaxal suma family dafa jaaxal suma xarit.
Okay léegi ci leeral ci investigation bi Mr Dabo ñu ngi wax ne yow ñetti flats yi nga jënd $500,000 loolu nga ko jëndee te am na benn ci flats yi according to investigation bi waroon naa jël 1.7 million but boobu ak yeneen ñaar nga jënda ndax noonu la demee yow noonu nga ko jëndee ñetti flats yi nga jëndee $500,000.
ñetti flights laa jëndee $500,000.
Okay.
I have all my receipt man nekkuma Gambia waaye anytime bi ma ñëwee dama préfère sax pour call press conference ma woon leen everything parce que lu ma la wax Gambia dafa tuuti ku nekk xam na kan mooy kan.
Okay.
Te man bema jende flights luñ ma wax moy government mom flights. That's why government mu ko jaay, not even Jane commission.
Okay.
Manelen why dama phone bu Yaya Jammeh la ñu ne ma no, if any property belong to Yaya Jammeh is already handled by Jane commission. The government mo ko mo. Lolo ta mo wachilu bit. And secondly, it's only one bit more South African tubabi ñoo buga scraps. Although planes they are not planes so called, they are scraps. So man feel na ne pour buy foreigner yobu suñ bagage. Na possibility pour jedda ko. Lolo ta ma ofali. In fact, planes right now, lumala wax right now, they are standing at the airport. So why man? My call. My problem is because man hamna ne defuma crime. Oxin la bindana ñu ne my habita gender nako. Why man always my pictures are headlines of the papers. Te fogna Jammeh's property ñu bari ñoko gender.
Okay.
Ñooñu dañ dunde def sen natali ci newspaper yi. Why? This is the 3 times these guys are putting my picture on the papers. So lolu man nak munuma ko understand ngeen find out alma luta ñu dé def lolu. And secondly, man jënduma plainly as Modu Turo Dabo dama jënda.
Allo. Line bi xam ngeen ne nekku ci dëkk bi so dinañ try pour ñu waaw ñu re-establish because fu mu nekk dafa am solo te am na leneen li ma ko bëgg a laajte tamit waaw
Hello?
Yes, go ahead. Ñu ngi lay dégg léegi. Yeah.
Mane.
Waaw.
Luma la bëgg a wax lan mooy suma problème ñu bari ñoo jënd foog naa ñoo jënd Jammeh's property nekkuma Gambia de waaye according to gars yi luñ ma wax ñu bari ñoo ko jënd waaye ñu ko jënd kenn nekku fa koo xam ne dañ lay jël nataalam yi def ko si newspaper bi only Modu Turo waaye dat loolu moo may xala jaaxal parce que Modu Turo jëndut lii compagnie bi moo ko jënd
xam naa loolu Mr. Dabo waaw xam naa soo ñëwee Gambia loolu comme noo ko waxee da ngay oote press conference mu gën a leer but ñu bari tamit mun nañoo gisee ne yow li ma bëgg a laaj rek mooy you are one time a close associate with the former president ndax am na leneen loo jëndaat ci bagage yi ndax jëndaat nga ci land wala any other Jammeh's bagage wala aircraft yi rek
non ma tuuti man gis nga balaa maa jënda aircraft yi I first ask whether this belongs to the Jammeh's asset. You never know. I'm not that type. Man yalla, I'm content what God give me. Man Jammeh's property, suñ ma ko jaayee $5 is a duma ko jënda. Parce que yalla lu ma jox, I'm content with it. Why be laajte naa ko 3 people, jarul ma mention the name. Ñu ne ma Jammeh's assets is already handled by Jane Commission. This one is government moo ko jaay. It belong to the government. Plainly, it belongs to the government. That's why Minister of Finance ñoo ko jaay. Lii lañ ma waxee.
Okay. So as far
I even asked my lawyer, I even asked my lawyer, mu ne ma omu tooñaale Jammeh la property be Jane commissioner be handle kan. Bari ñindo government le tam. If you can buy it's fine. No la binda ma offer.
Okay.
So bema offer one day mangfa bena jigen call ma munema you are the higher offer. If you can pay now against I don't know 2 o'clock, 3 o'clock. It was around after 8, 9. Non la continue madam the same day la transfer Halisby, ma jël receipt bi ma yoni len.
But for the sake of clarity, 3 people yi nga waxal you don't want to mention name but comme yow tudde nañ la ci li don't you think it would be good pour nga mention tamit pour nit ñi xam ñan nga doon waxal?
Mention right?
Yes, you 3 people you said you don't want to mention names. Mané fogulo da nga waroon a tudda ñi nga xam ñi nga doon waxal pour ñu xam ñan nga waxal bala ngay jënd ñu wax ne it's a government property. What important is fogna this is my first time for mo waxal rek. First time in my life. So gisee ma wax la ma call sa dama bëgg man leen rek moy suma problème. Du affaire yi jënda bi. Jënda bi am na right auction nañ. Ofana am naa ko as a Gambian
Lolo worry see. Why my problem is why my picture is always at the headline of the newspapers. The man jënduma ko company bi moko jënda te orders yi ndé binda dañ dé wax company nangam ab why picture si ben picture Gambian musta neka the headline why this is the 3 times these guys are putting my picture on the headline te defuma ben crime man li la bugala wax pour ngeen find out man lutax why afri jënda mom wariwuma si because bala mako def I have talked to my lawyer munema this is a government property. The auction la am nga right pour offer. So amé nga jël ko. Té lool la def.
Okay. Now the three flights
Gambian offer would fly. There is no Gambian ko xamné offer gonna fly. Tuba bi ñew offer. Ma offer more than that. After you call ma ñu né yow ya am high offer. Then they give it to me and still if they want to fly, let them go to the airport. The flights are there. Let them take it. Man dama farale suma dëkk rek pour at least foreigner yu baña yóbbu property loolu tax ma def ko su nekkee leneen moo tax ma def ko by now how many years almost 6 to 8 years now flights yi ñu ngi taxaw foofu I even forgot that I bought flights so man loolu du suma problème nag man suma problème lu ma la wax ne why my pictures are on the headline all the time
okay
loolu
now, Mr. Dabo, you have raised that concern. Do you intend to do anything for gis ne lolu stop na comme yow am nga ci problem all the time sa picture ñu ko gene? What do you want to do about that? And am nga anything that you intend to do or take, for example, for gis ne lolu stop na?
No. Man def ma jaaxal man ki lum def ni suma amé xaliss sa pour joko ko naa ko jox because it's a Gambian te definitely lii nii nit yi war nañ koo xam.
Okay.
Moom ñëw na tuma office 2 years back mu laaj ma jokko all the papers ma woon ko everything naka Sirif Bojang newspaper Sirif Bojang naka la tudda not point newspaper Sirif Bojang.
Standard.
ñoom Cham. Standard ñëw na foofu ñu laaj ma I tell them everything ñu public.